Welcome to the Functional Medicine Foundation's podcast, where we explore root cause medicine, engage in conversation with functional and integrative medicine experts, and build community with like-minded health seekers. I'm your host, Amber Warren. Let's dig deeper. Welcome back, everybody. I'm here with Karli Trudeau, right?
Trudeau.
I was so close. Karli Trudeau, she's a registered nurse here with us now, thankfully here at our new Eagle Center. She was only in Meridian before, and now we get to hang out every week in Eagle. So Karli Trudeau, yes, is a dedicated registered nurse who graduated with a nursing bachelor's degree from Lewis Clark State College. Karli gained early experience in a fast-paced hospital setting, but motivated by her belief in functional medicine's transformative potential, she bravely shifted her career focus, and we're so thankful. At the core of her nursing practice lies a commitment to helping people feel better. Karli values direct patient care and uses her expertise to educate and empower individuals to make informed healthcare decisions. Beyond her nursing career, she finds adventure in hiking, traveling, and cooking, showcasing her true culinary passion. Karli's genuine compassion, desire for knowledge, and dedication to meaningful connections make her an exceptional healthcare practitioner. And I could not agree more now that we've had the honor of working with you. So Karli really manages, Peptide Queen, here we go. I actually want that title. I told Sammy I want the title of Peptide Queen, but I feel like
it's mine for now.
It's yours. You deserve that title. So your role here, you do all of our IV therapy here at our Eagle Clinic, Center for Optimal Health. And then you do kind of all the peptide training, ordering, education, all the processes, and a lot of that. What's your favorite part of what you get to do here?
Honestly,
not a trick question, but put you on the spot.
My passion has always been patient care. I love face-to-face with patients, talking to them, hearing about how their course of treatment is going, and just getting to see those little changes over time. And when you're following the same people for an extended period of time, it's the best part. Feeling like you're helping.
I know. It's really an honor to kind of get to do what we do and be part of people's journey. So peptides are a huge buzzword. We've talked about this a ton, not only on this podcast, but we talk about it a ton there in the rooms, educating our patients. You and I both can kind of have this discussion, but I think our patients and the community really want to know that peptides not only are effective. I think we've proven that peptides are effective, but I think we're getting a lot of feedback that our patients want to know that they're safe and they're clean, and we're getting them from trusted and vetted sources. So I guess we could just start with a quick intro on kind of what peptides are. I don't know if you want to speak to that. I'm happy to kind of speak to what peptides are. Just strings of amino acids, right? Yep. Totally innate, natural to the body. How do you explain to the patients kind of what they are at a base level?
Yeah, so I start with that, obviously the strings of amino acids, and I think explaining that this is something our body recognizes. It's not a foreign medication that our body has no idea what to do with. Our bodies are trained to know how to utilize these different peptides. So, and I think when people hear peptides, well, first of all, I have a lot of people say, "Oh, is that an IV infusion?"
Oh, really? Do they?
Much easier than that. But I think the first thing everyone thinks is Ozempic, like the scary Ozempic that there's been so much controversy around. So I think once people realize that there are so many, thousands of different peptides that can be used for different things, and that we have the ability to kind of figure out what type of peptide is going to help a specific patient the most. I think that definitely helps, knowing that it's not just a blanket term.
Yeah, absolutely. I think where I educate a lot of patients is insulin is a peptide that our pancreas makes that we give our diabetics. It's insulin is a peptide. It's just a different combination of these amino acids, these building blocks of proteins. So on the topic of making sure we're getting ordering our peptides from vetted sources, tell us a little bit about the pharmacies that we order these peptides from.
Yeah, so we have two main pharmacies we use. One is called New BioAge, which is actually a network of pharmacies within itself. So they're a huge company. The other one is called Pharmakeo, and that is its own separate custom compounding pharmacy. So majority of our peptides we get from New BioAge, which they've been an awesome company. They provide a ton of trainings for providers. basically any question I have, like no wait time. I can talk to someone immediately or email, whatever. Yeah. So super responsive in that aspect. And also we've just had overall really good like experiences with the different peptides they have. Yeah. And then Pharmakeo has also been great. We have specific peptides we order from that pharmacy. Honestly, like from shopping around and figuring out, okay, how can we get the best price for our patients with the best quality, and kind of basing off of how patients have done with different peptides from different places. We've kind of narrowed it down to, okay, we get certain ones from New BioAge, certain ones from Pharmakeo.
Right.
So basically when a patient is interested in starting on peptide therapy, whether that's through one of our packages, through having a peptide consult with one of our providers, I will place that order specific to that patient based on the different dosing instructions recommended by the provider. And then the peptide will arrive to us, we'll call the patient in, and I or one of our medical assistants will do a sit-down, step-by-step training from start to finish, how to store your peptide, when to inject, how much. So really any detail regarding all of that. And then obviously any side effects, things to look out for. So it really is start to finish, us kind of holding the hand of the patient, making sure questions are answered. And
yeah. I think it's really appreciated. I think those patients really, because it's, I mean, and most peptides are injection. I think 90% of the ones that we prescribe here are injectables, and that can be a little daunting for patients.
Yeah, most people have never injected themselves with anything.
So tell us about what the injection's like.
So it's a subcutaneous injection, which in my opinion is the easiest kind of injection you
right
can
under
do.
the skin, sub-Q.
Yep. So you want to just so subcutaneous is your layer of fatty tissue. So we have that on our abdomen, our sides, back of your arms, thighs, and butt. Those are the most common spots. And so when a patient comes in for their first education session, I'll show all those different areas, show a patient how they can access those areas. So typically you want to be able to pinch that skin and then inject the needle in. It's super tiny needle. So it's a 31 gauge, 5/8 inch insulin needle. So super small. Most people can't even feel it when it goes in. So a lot of times I'll offer to do the first injection for them so they can kind of get a feel for it. And I'll give a paper with step-by-step of the whole injection process that they can reference. But yeah, subcutaneous injection is how you'll do all the different peptides. And some of those will be once a week injections. Some of those will be up to 3 times a day. So it just depends on what peptide they're going to be doing.
What are you seeing? And I rely on you a lot for this, I know, just in clinical practice, because the patients kind of know you're the peptide guru, so they call you with side effects, or we'll send you a portal message on our online EMR about side effects. What are you seeing as far as side effects with most of these peptides? And is there a peptide that we prescribe more where you see more complaints or side effects from it?
Yeah, I would say tirzepatide, which the name brand for that is Mounjaro. It is targeting weight loss. So when you're dealing with weight loss and you're dealing with the digestive system and that whole process in the body, most commonly you're going to have GI-related side effects. Yeah. So with the tirzepatide, especially when patients first get started on it, it can be kind of a shock to the system, and some people can have some issues with nausea or constipation, occasionally some diarrhea, but not super common with this one. Yeah. So GI side effects are the biggest thing, but honestly, it has been pretty rare, I would say. And explaining to patients that this is something that might take a little bit of time for your GI system to get used to. Right. Maybe the first 1 or 2 injections, and then after that, most people are pretty smooth sailing.
Do pretty well.
Yeah.
Yeah. Yeah. And I love tirzepatide. I mean, I view, and I educate people, our patients on tirzepatide as like the new and improved Ozempic or semaglutide.
Absolutely. Oh, the side effects have been miraculously better.
So glad to hear you say that.
With tirzepatide than with semaglutide.
Yeah. So semaglutide was one of the first glucagon-like polypeptides that came on the market, weight loss polypeptide. And it's kind of all we had access to for really the 6 months of us doing this kind of cash pay peptide thing. And then tirzepatide became available to us, and it was like, oh, new and improved.
Yes.
And I even hesitate to call these glucagon-like polypeptides weight loss peptides because we're learning they do so much more than just weight loss. Like I'm seeing prediabetes completely reversed even after just 4 to 6 weeks on this tirzepatide.
High cholesterol. Yeah.
Yes. And even the small sticky particles that are really big drivers of risk for atherosclerosis and heart disease, they drop to complete optimal levels. We know what it does in the liver as far as just hepatic protection, fatty liver, glucose storage in the liver, even some of the benefits on brain, nerve protection in the brain, neuroinflammation. It decreases what's called NF-kappa B, which is an inflammatory marker in the body. Really, amazing stuff that I think data continues to come out, improving memory. I think that I know there's been a lot of controversy on this peptide, and I know you've read about it, and I'm sure you've had patients ask you about it. I think there's a lot of patients that will say yes to me as the PA that comes in the room and says, you need to do this, this, and this based on your labs or based on your health goals. But then they probably go home and read about it or think about it, and then when they show up for their education, they're like, okay, Karli, I have hesitations.
Yeah.
Do you find that a lot?
Yeah.
I'm sure.
People will definitely go home and stew on it and do their own research and then come back with hesitations. A lot of it is relating to things that we can help with along the process.
Yeah.
Like there's going to be a huge difference between someone who's getting their tirzepatide from a random website online and
which is happening. There's
with
a lot of those.
No instructions, like you don't know anything about this pharmacy, where they're getting their products. And you just go for it at home with no supervision. Yeah, there's a good chance you're not going to have all the tools you need to try to feel your best. So, like whether that's being on a fiber supplement to help prevent constipation or having access to a dietitian like we have here to be on a good diet plan in order to not get constipated and not feel nauseous and to make sure you're getting in the amount of calories you need in a day to keep your body in a healthy metabolic state.
Because tirzepatide is an appetite suppressant.
Yes.
So a lot of times we are tracking those patients very closely, and we work with Haley, our nutritionist, to make sure they're getting the micronutrients they need because it can work. And it's really random. Everybody responds so differently. Some people, like at the lowest dose, they don't really notice too much appetite suppression. Other people are like, I have patients that at the very lowest intro dose, they're like, this is all I need just to calm my cravings and calm the emotional relationship that I realized I had with food and realizing how unhealthy their relationship with food is. And that's where I think I get pretty fired up just reading some of the negative comments and some of the controversy that we're seeing on tirzepatide. Things like, oh, well, you just don't want to exercise, so let's just take a weight loss drug, or take this peptide, or you just don't want to eat well, or you don't want to put forth the effort to lose the weight. And I'm like, I think those are individuals. It's easy to throw those stones because they haven't dealt with an eating addiction disorder. They haven't dealt with emotional eating issues. They haven't, I'm like, if you don't know what that's like, you don't know that this peptide can really calm the brain and calm those food addictions and that even people struggle with.
Like hormonal imbalances, like people with PCOS, it can be really beneficial for that insulin regulation to help with weight loss that way. And I think a lot of people, the stigma around it is, oh, let me inject myself with this once a week and sit around and just let it work. When that might not work. It helps to be putting in the effort elsewhere as far as diet, exercise,
right?
Just having that full, well-rounded approach to health.
Yeah.
Because eventually, like, this isn't something that you stay on forever. Like, this is
we don't let our patients stay on this long term yet.
Ideally 5 month, 5 to 7 month
I would
course.
Agree. I would agree.
And the fear a lot of patients have is, okay, what happens when I stop? Am I going to gain all this weight back and reverse all the progress I've made? And I think that's why the way we're doing it here is so beneficial, because we're trying to teach patients the full approach. So the exercise and the diet and how to use the tirzepatide as a tool to help you on the journey, but not as like a quick fix.
Yeah.
So it's just like any fad diet out there. It's not going to work if you're looking for the quick fix. So I think having it as a way to help a patient reach a goal, and it's an aid to help you.
Right. And it helps to jumpstart.
Yeah. It's a jumpstart. And then eventually it's training your body to look at food differently, training your mind to not require as much as you might have at one point.
Resetting those cues, resetting those triggers, because I think a lot of us carry things from childhood or habits that were in our home as a child, whether it was you had to have a carb with every meal or there was a sweet with every meal.
Yeah.
Like I have one patient, such a phenomenal guy, and he's had dramatic success with our weight loss program, which of course, it's all the things, right? It's comprehensive lab workup, it's working with nutrition and health coaching, and there's very specific exercise goals and looking at all the micronutrients he needs. But what was his statement? He's like, I would finish a meal and realize I didn't need another serving of the carb, or I didn't need to go grab something sweet. Like I was so satiated, and it was so empowering realizing like I can have my balanced meal and be done. And he said to me, I was realizing I was underestimating how much I was living to eat and not viewing food as fuel and eating to live. And it was everything for him. Yeah. And so I know he's going to have lifelong success. And he came to me with about 100 pounds to lose, and he is really close to that goal.
Yeah. There's been so many patients that have echoed that exact sentiment of they just needed that boost, that little push to help with that rewiring and that retraining. And
it's huge.
And then those are tools, and that's a mindset that you can take with you even once you're done with the program. So
absolutely.
Yeah, it's been we've had a lot of happy patients, which is great.
I'm so glad. So that's probably our most popular peptide that we prescribe here. I would agree with that. Okay. How about the other ones? What else are you seeing? What other peptides are patients really liking? So the
CJC 1295 in combination with ipamorelin has been that's second. My favorite. Yeah. So I'm a pretty big fan of that one. I haven't done it myself personally, but it's still helping with the weight loss goals for a lot of patients, but it's also, it's a growth hormone releasing peptide. So it is triggering muscle growth. So, which a lot of patients worry with the tirzepatide, I'm going to lose all this weight. I'm going to have muscle wasting. Like I'm not only going to lose fat. So this is one that we can add in later in the process to help with muscle growth.
And exercise recovery.
Yes.
And muscle recovery. That's why I'm also really impressed with that.
And sleep. The nice extra.
Are you having patients noticing benefits of sleep? Oh,
people will say, I haven't noticed any change with my weight yet, but I'm having the most vivid dreams. It's like really interesting. So sleep is big with that one. I will say it's one that I feel like will work best if a patient is doing some sort of weight training. And exercising. Good. So if they're specifically looking for muscle growth.
Body composition. Right.
So for a lot of those patients that are like, okay, I've lost a ton of fat and now I really want to like tone up and lean out. It seems to be really great for that one. Yeah.
That's awesome. I love the anti-aging benefits of that one.
People call it the anti-aging peptide.
Hair growth. nail growth, skin, I've been really impressed with. I mean, it makes sense mechanistically because that's all things that growth hormone helps to work on. But yeah, I think that's a really good one. I've just been putting patients on protocols. Hey, let's do 3 months off or 3 months on. Let's take a month off, 3 months on. I've been using it a lot for my osteopenic patients. So with metabolic bone loss, to help encourage bone growth in a very natural, just naturally boosting growth hormone.
Yeah.
Because there's a lot of medications that are really hard on the kidney, or side effects can actually be a femur fracture with some of these osteoporosis medications. So I have a lot of patients coming to me because they're hearing about some of the benefits with these peptides. Yeah, it's awesome. On the anti-aging topic, one that I think is just starting to really make its mark out there, and it's unfortunate because I think there's so many awesome peptides, but I feel like the weight loss peptides kind of overshadow a lot of the other peptides that are out there and available to us and so darn safe. Epitalion. Have you had much experience with Epitalion?
I honestly
no,
nothing.
You haven't. Okay, so Epitalion is one, and it's expensive, so it's probably why there's not a lot of patients that use it. But it's I've noticed it a lot of the med spas touting this Epitalion because it helps to increase and activate telomerase, which is the enzyme that helps with telomere lengthening, which is like one of the biomarkers that it's kind of all the rage right now to look at with accelerated aging. So if we can prove that we can help to elongate telomeres, then we halt and slow down. I mean, we don't know how to halt the aging process, but we can slow down the aging process. So that's when it's interesting. It's like a protocol of like a 10-day protocol that you do every 6 months for 2 years. So it's like 4 sets of 10 days. And I've read a lot about, and I've actually used it on a few patients because it also helps to reset circadian rhythms. So for sleep, for insomnia, for sleep issues. Yeah. So that's one that I'm really intrigued by. Again, I'm hoping kind of the price, it's about like $700 or $800 per 10-day course is what I'm seeing right now. So I think the price is a little bit of a deterrent for some people, but really interested in that one. And then on the topic of sleep, DSIP, Delta Sleep Inducing Peptide. I think when that one does work, there are definitely some patients that don't respond to it as well as I would have liked.
Yeah, but when it works, it works.
Okay, I agree. When it works, oh my goodness. I almost feel like, I mean, we have so many amazing supplements for sleep, but I'm like, this peptide is magical. And again, just to help regulate those circadian rhythms, and it works really well.
I've had a lot of patients that have really liked that one. Because, I mean, when it comes to sleep, obviously people, like, you need your sleep. And people will get so tired of being tired. And there are so many different sleep aids and things that you can take that either eventually your body is going to be too used to it, like with melatonin, like eventually you're going to build up a tolerance to it, and it's not always going to work. So for those patients, when the DSIP works for them, that's a game changer.
Are you tired of cookie cutter health that doesn't address your unique needs? It's time to discover functional medicine care designed to help you flourish. At FMI, you'll have access to a range of benefits tailored to support optimal health and longevity. Experience the power of personalized care and take control of your health with an annual membership at FMI Center for Optimal Health. Visit fmioptimal.com/membership today to become your absolute best.
It's amazing. I feel like we use a lot of BPC 157, body protecting compound. How are you seeing it being used, or what kind of benefits are you seeing?
So that's one we can either do as an injectable or as a capsule. So to take it orally, the oral use for it is for gut healing. So we've had quite a few patients that have been on like omeprazole, for example, for an extended period of time, and are wanting to make the switch because I'm sure we've all heard of all the potential long-term effects of taking omeprazole. So I've had patients take it for that and essentially say that any gastric reflux or heartburn that they would have after every meal has completely gone away. So that's amazing. And then the injectable is used for healing purposes. So we've had quite a few patients that have either had multiple surgeries in a certain area, injuries, etc. And yeah, you can actually inject the BPC 157, and it's going to help with ligament, tendon healing, skin healing, muscle healing.
Yeah.
So I think that's fantastic for anyone that has gone through some sort of physical trauma and they're not wanting to have to take some sort of pain relief the rest of their life, or even people,
injury prevention.
Yeah.
Like people who are trying to get in a new regimen in the gym or just trying to build muscle. I love using that one with the CJC 1295 and Pamorelin, just for exercise recovery and muscle growth and regeneration. I think it's really, really huge. Yeah, I actually have a case where a patient came to me with pretty significant gastric ulcer and wasn't having luck with anything else, and obviously didn't want to stay on the PPIs, and 8 weeks, 2 months of BPC, gastric ulcer.
That's great. Yeah.
Gone. All of her indigestion, pain gone.
Well, there are people who will be on some sort of PPI for 20 years straight, like daily use. And no one ever tells them.
Makes me angry. I know.
No one
Not
ever
intended for long-term use. Yeah. It's so disheartening. Solank is one that comes as either an injectable or intranasal for anxiety and depression.
Yeah.
And I was doing more research on it. I came across it, I think this was like 3 or 4 weeks ago, on what it does for BDNF in the brain, which brain-derived neurotrophic factors are like, I love Dr. Holthouse describes it as a miracle grow for the brain, helps the brain grow. But for memory, cognition, it increases serotonin and dopamine. And I mean, mental health, that's such a big deal right now too, right?
Huge.
And SSRIs, I think, are becoming one of those top prescribed pharmaceuticals in our country. So if we have a natural approach to helping people with anxiety and depression and just calming themselves down. Yeah, I've had success getting a few patients off SSRIs using that peptide. And I love the option as like intranasal, because there's not a lot of people want to inject. Even if it's teeny tiny little insulin needle.
Yeah, and a lot of the intranasal peptides there's a range for how much you can use it. Right. So it's one of those things that you can use as needed, which is fantastic for people that are struggling more with not necessarily around the clock anxiety or depression, but just at certain times. And that's a whole lot better than popping a Xanax.
Yeah, exactly.
Yeah.
Oh my goodness, exactly.
And just to have, for patients that do struggle with that, to have that hope, like if this does work for you, it's something that you can be on, that you can use for a long period of time. Safely.
That is one that we would definitely prescribe long-term, or maybe some of the weight loss peptides or the growth hormone. Those are not necessarily ones that you want to take for long periods of time. Kisspeptin is another one that I've had really good success with. Kisspeptin is one that naturally increases luteinizing hormone. So really good at naturally increasing testosterone in men. TRT, testosterone replacement therapy, can decrease sperm count and fertility. So for a lot of these younger guys, and I know I talk to all of our providers here about this, but we are seeing an epidemic of younger and younger men with low testosterone levels. And we always talk about why we think that is. Stress, sleep deprivation, environmental toxins, all wreaking havoc on our endocrine glands. But so for men that want to preserve fertility, but still want improved sleep, want to be able to get into the gym, have a decent libido, I love the Kisspeptin just as a natural way to increase libido, energy, and get testosterone levels optimal. So I'm really, I like using this Kisspeptin as well. I know we're trying to problem solve because peptides have become so popular. We're having a lot of delayed shipping times. We have patients
all the time
frustrated.
It's the most frustrating part of the process.
Probably made your job a lot harder
for me and for our patients. So
one of our Florida pharmacies used the hurricane excuse for a while, and I'm like, okay, guys, that was a good month ago. I don't think there's still a hurricane down there in Florida.
Not anymore.
Get us our peptides.
Yes. Yeah. The popularity, it seems like it comes in waves where the pharmacies will reach out saying, we are so behind on orders right now.
Yeah.
And when it's a custom compounding pharmacy. So everything they're sending us is being made. They don't just have all
order
these
from
peptides.
China? That's good to know.
It's amazing. One is in Florida, one's in Texas.
Yeah.
And they don't just have shelves full of peptides that they can immediately throw in a bag and send to us. So it's all custom compounded, and then they cold ship everything to us, which is nice. Most of these peptides are stored in a refrigerator. So the shipping delays are tough.
Yeah, I know it's been brutal on all of us, but especially you. We're trying to problem solve. I know I can't make this.
We are.
I got in trouble because I made a promise to some patients. Oh, don't worry. It's okay. There won't be 3 weeks between your protocol. We've got some here in the back. We now we stock it here. And Karli's like, no, that was for emergencies only. We'll run out of it. Like,
we're trying to keep an emergency stock for.
Well, so we don't interrupt protocols.
Yes,
these
because
protocols we're doing,
for a lot of these, especially with the tirzepatide, so with that one, you're doing typically 4 weeks at a low dose, and then you're increasing. Right. So every 4 weeks, you're going to increase that dose. And ideally we don't want any gaps during that time. So that's something we're really trying to stay on top of, and making sure patients have what they need.
No, it's great. There's one other one that I'm pretty excited about. I learned about using this combination at a peptide conference recently, GKU copper. Learning that they combine it with a compound or a peptide called argonolox, and for wrinkles of the skin, so like a natural
Botox cream.
I know, Botox cream. So I know we've prescribed it for people like with scars. Have you seen good luck with it? Are people having benefits to their like scars or skin with that?
I haven't seen specifically the scar patients. I feel like majority I've seen are more for like Botox purposes.
Cosmetic reasons.
Cosmetic reasons.
But I learned for it to be most effective, you need to use the cream and the injectable.
Yes.
At certain intervals. So that's what I think I'm going to start recommending. Okay. Yeah. That's great.
Yeah. And I think that's worth it to not put a neurotoxin.
Couldn't agree more.
In your muscles.
Well, it's easy for you to say you're young and your forehead's beautiful.
Thank you. Botox
call me in 10 years. And we'll talk. We're so thankful to have you, Karli. You are such a wealth of knowledge, and you're so good with our patients, and you're really helping us give such a good experience for our patients and making them feel really confident and comfortable and like they're in good hands as they kind of start this process. So
thanks. It's good to be here.
We're thankful. Oh, we're so glad. You know, or maybe you don't know, maybe you've never listened to our podcast before, but we like to end each conversation with, if on this or a similar topic of what we discussed tonight, what's one piece of advice you can give our patients related to peptides or peptide education that you feel like really moves the needle for them?
I would say remembering that peptides are not meant to be a quick fix, and that they are something to aid you in your journey, whether it's a journey to healing, a journey to better mental health, lower stress, weight loss, muscle building, whatever path you're going down, there's likely a peptide that can help you in that journey, and that you'll have a team of people here every step of the way to help you with that. And just to, not think of it as such a scary thing. And if it's something you're interested in, it's worth a try for a lot of people, I think.
Yeah, I agree.
Yeah.
I remember when we first started learning about peptides here last year and started to kind of get into this world and become educated, I was worried that maybe we'd have a lot of patients coming to us just wanting that prescription, just wanting that peptide, right? And we like them to do the whole rigmarole, but I don't see that. They come to us because they want everything. They want the full comprehensive lab workup. They want us to cast that wide net, to figure out all the reasons they're having weight loss resistance, or figure out all the reasons their hormones are disrupted, or all the reasons their bodies can't detox. So I thankfully haven't had to deal with that a lot. Like
I know it really seems
willing
like
to do all the work. It's
majority of the patients, they don't want the quick fix. Most people really want, like, they're ready to make that change and ready to start going in the right direction. So we have the whole team to do it. So
we're pretty lucky. Our patients
are
great. Yeah, it's awesome. Well, thank you, Karli. Thank you for your time.
Anytime.
Thank you for listening to the Functional Medicine Foundation's podcast. For more information on topics covered today, specialties available at the FMI Center for Optimal Health, and the highest quality of supplements and more, go to funmedfoundations.com.